All right, let's talk about the rest of muscle. So this last half of the last third of this chapter, we're going to talk about the muscular system and functional organizations. We're going to go into axial and appendicular muscles. We're going to start by talking about actions that muscles can perform, and some background information there. And then we'll get into identifying specific muscles. You should be able to identify the specific muscles that we discuss, and then actions of those muscles. And those actions are related to the origin and insertion. So the origin and insertion of a skeletal muscle are the points of attachment. So where do these muscles, by way of their tendons, connect to bone? The origin tends to be the fixed end of a muscle. So think about the bicep muscle. When the bicep muscle contracts, it flexes or bends your elbow. So the origin is the point that's not moving. So the point of it, there's 2 points of attachment at least for each muscle in the body. The point of attachment that doesn't move much is the origin. So think when you're flexing your elbow, the muscle attaches up in your shoulder but doesn't move at all. The insertion is the movable end, where it inserts on the radius, the bone in your lower arm, so that it flexes your elbow. The action is what we're talking about here, this flexion extension, right? So flexion extension, the biceps brachii muscle, the bicep in your upper arm, the action of that muscle is to flex the elbow, right? So that's a specific movement of that muscle. So here's the action of the bicep, right? Here's the origin of the bicep up in the shoulder, not movable. Insertion, movable. And when the muscle contracts, the action is to move the point of insertion towards the point of origin, right? So the action is flexion here, flexion of the elbow. So the biceps brachii is flexing the elbow, but it has some help. So the main or prime mover of that action is the agonist. So in this instance, the biceps brachii is the agonist muscle. A muscle that helps the biceps brachii do its job is called the synergist. So a muscle like the brachioradialis, I'll show you on the next slide, helps the bicep do its job. But the major mover, the strongest mover of that motion is the bicep. And then the antagonist muscle would be a muscle that opposes that action. So in this instance, the antagonist muscle to the agonist, which is the biceps, is the triceps brachii. So take a look here. Right, here's the elbow joint, right? Humerus, radius, ulna. The biceps muscle is inserting here. It's the agonist muscle, or the main mover, the strongest mover of that action. The brachioradialis is a muscle that also attaches to the humerus, but then in the radius, and it helps the biceps brachii do its job. So it helps flex the elbow. The antagonist muscle is the tricep. So look at where the tricep inserts here, and it would extend the elbow. So it opposes the action of the bicep. Naming muscles is based on several different points. So one muscle can be named based on several of these points. Based on the region of the body, like a femoris muscle. Where's the femoral region of your body? Your upper thigh. So that thigh region there's a muscle called the rectus femoris, we'll talk about later. Some muscles are named based on where they're located, so their position, like the tibialis posterior. Where is the tibialis posterior located? On the posterior side of the tibia. The nature of the origin. So how many points of origin, how many points of attachment is this origin? The biceps brachii has 2 origins, so 2 points of attachment at the origin, the non-movable region. The tricep would have 3 points of origin. Some muscles are named based on their shape, like deltoid is a triangle. So the deltoid muscle is the big shoulder muscle. We'll come in and identify later. Or a rectus muscle is also a particular shape. It runs along the longitudinal axis of the body. So like the rectus abdominis is one of your ab muscles. Size, there's a gluteus maximus or a gluteus medius or a gluteus minimus. You have 3 gluteus muscles in the gluteal region. So here's a muscle named based on the region of the body it's located in, the gluteal region, but also its size, maximus. Some muscles are named based on their action. So a flexor muscle would flex or bend. So the flexor digitorum, what does the flexor digitorum flex? The digits, right? Your fingers. Okay, there's a table that I wanted to put up here because it's really helpful in understanding how muscles are named. It's fuzzy in my picture, but it's figure 611. So glance over that table. It's really helpful in understanding terms and how muscle is named. So let's talk about movements of muscles or actions of muscles for a period of time, because understanding what an action is can help you understand what each muscle does. So the action of each muscle, like flexion, extension, and hyperextension. Flexion reduces the angle between two structures. So like bones of your upper and lower arm, your elbow flexes, your biceps brachii flexes your elbow, and that joint angle decreases. Extension is increasing the joint angle, and hyperextension is extending beyond anatomical position. So that'll make sense by looking at this picture, this figure 612. So I'll just stay with the hip because there's multiple examples here. So flexing the hip would be decreasing the joint angle from your trunk to your leg, right? So here's flexion. Extension is back to anatomical position, increasing the joint angle, and hyperextension is beyond anatomic position. So extending your leg back behind you is hyperextension. Lateral flexion is flexing a joint. So the joint angle is decreasing here, but it's laterally. So turn your ear, basically take your ear and try to put it on your shoulder. That's lateral flexion, either right or left. And that can happen in the head, and that can happen in the trunk as well. Basically when the vertebral column bends to one side. There's two specific actions at the ankle. One's called dorsiflexion. Point your toes up. Try to touch your toes to your shin. That's dorsiflexion. And plantar flexion is pointing your toes or going up on your tiptoes when you're standing. So think about planting your foot. That's plantar flexion. Adduction and abduction refer to movements of the appendicular skeleton. So think about abduction, abduction, like taking something away, like an alien abduction. When you move something away from the longitudinal axis, so move your arms away from your body into a T. So make a T with your upper body. That's abduction. And now take that T in your arms and add them back to your body. That's adduction. So there's adduction, moving the arm or leg towards your body, and abduction away from. You can also adduct and abduct your fingers, and adduct and abduct your wrist. Circumduction is specific to the shoulder. It's basically tracing a large circle with your hand. So think the circumference of a circle. Right here is the circumference of this circle. Circumduction is moving your arm in this big, huge circle, right? Your shoulder joint allows the ability of the muscles around it, multiple are involved, to circumduct your arm. Rotation, you can rotate your trunk left or right. So think looking left or looking right with your head or your shoulders, like rotating your whole spinal column. And your limbs can rotate. So your upper arm and your upper leg, you can medially rotate or internally. So rotate the upper arm in towards the midline of your body, and move it away from is lateral rotation. So rotating your shoulder or rotating your hip, you can medially rotate internally or laterally rotate externally. Here's medial and lateral rotation of the upper arm. So medially towards the body, laterally away from. And there's left and right rotation. Pronation and supination are specific to the radius in your lower arm. So look at the radius here. There's a point of, the point of attachment of articulation at the elbow, and down here is the wrist. So look at what the radius does. This thumb side bone, when it flips over, that's pronation, or turning your palm down or away. And then supination is turning your palm the opposite direction, basically facing your palm forward in anatomic position. So pronation and supination are related to muscles that just move the radius. So there's the radius that flips over top of the ulna, right, in pronation, and then back to anatomic position is supination. Opposition is specific to the thumb. Basically, you take the thumb and touch the palm, the opposite side of the palm of your hand, or the pads of your fingers. Inversion and eversion are also specific at the ankle. Inversion is moving the base of your foot or the sole of your foot, the bottom of your foot, inward. Eversion is turning it away. Protraction, retraction, elevation, and depression can be specific to both the jaw and also the scapula. So you can elevate, lift, or depress, lower, both the jaw and the scapula, right, your shoulders. Or you can protract, move them forward along a horizontal axis anteriorly, or retract. Think about retracting a statement is to pull it back. So retracting your jaw or retracting your shoulder blades, your scapulae, is pulling them posteriorly in the horizontal plane. So let's talk about these muscles. Axial muscles we'll start with, and then appendicular. The axial muscles position the head and the spinal column, and we're going to focus on, there's hundreds of muscles in the body. We're only going to identify a number of them and talk about their origins, insertions, and actions as well. So the muscles that I focus on in this lecture, you should be focused on for the exam and for the quiz. So the next two slides I'm going to slip past because these are just kind of overview slides. We're going to focus on larger figures like in the muscles of the head and the neck. Some muscles are involved in facial expression, so think about like smiling or frowning. Some muscles are involved in chewing and eating, right, by moving the jaw. You heard my dog in the background there. Sorry, guys. Oh. All right. There we go. Okay, so muscles of the face and neck. Those muscles are muscles of facial expression and also muscles of chewing. So we're going to talk about a couple of them on this slide. On this slide particularly, we've got two muscles that are named based on their location, but also their shape. So the orbicularis oculi, check this guy out. An orbicularis muscle is a circular muscle, and oculi is around the eye, right? This muscle closes the eye. The orbicularis oris is also an orbicularis or circular muscle, but now not around the mouth, the eye, oculi, but oris, right? Around the mouth. Good. This one purses your lips, right? Like you're going to give a kiss. This muscle up here is called the zygomaticus, right? So it's actually labeled over here, the zygomaticus muscle. That muscle attaches to the zygomatic bone and just the lips. So think about what this muscle does when it contracts and the lips are the insertion and move towards the origin. You smile. The last muscle on here is the masseter. This masseter muscle, you can see a little bit better on the next slide. Here, so origin is the zygomatic bone, and the insertion is down here in the mandible. So when the mandible moves towards the origin, what do you think is going to happen here? You're going to chew, right? So this is one of the major muscles of chewing. So this muscle and this muscle up here is the temporalis muscle. So think this is the temporal bone, the point of origin, and the mandible down here, your lower jaw, is the point of insertion. So these two muscles together, the temporalis and the masseter muscle, close your jaw. So elevate the lower jaw. So in chewing. So I want you to clench your jaw, like close your jaw, clench your jaw, and then feel on the side of your cheek and the side of your head on your temples, the temporal muscle, the temporal bone. And when you do that, you clench your jaw, like or chew gum or whatever, you can feel those muscles contracting. Muscles of the vertebral column are arranged in several layers. They originate or insert on ribs and vertebral processes. So as a whole group, they basically extend from the back of the skull, the occipital bone. So put one hand on the occipital bone and try to extend your neck, and another hand on the sacrum, that bone that attaches to or articulates with the hip bones, and extend your whole back. There's muscles there that basically keep you erect and standing, and extend your back and your neck all the way up the vertebral column. And there's three major ones we're going to point out on here. They're collectively called the erector spinae muscles. And the erector spinae muscles are a group of three different muscles. The spinalis, which is this whole group of muscles here, the spinalis muscles, they actually originate down here on the sacrum, run all the way up to the cervical vertebrae. And there's a bunch of them that kind of connect along the way. The longissimus, which is another group of muscles here that originates on the lumbar vertebrae, runs all the way up to the thoracic ribs. And then the iliocostalis. Break this word down. Ilio, ilium, right? So the iliac crest here. Costal is ribs. So that this muscle runs from the ilium all the way up to the ribs. So think about when these muscles are contracting, you're basically standing upright. So, and then let's look at these words. Ilio, I, longissimus, L, spinalis, S. So you can remember I, like standing. These muscles help you stand up erect. There's oblique and rectus muscles in the abdomen. An oblique muscle basically has fibers that run at an angle to the body, and a rectus muscle runs parallel. The muscle fibers run parallel to the body's axis. So here's a couple of oblique and rectus muscles. These oblique and rectus muscles, so here's the rectus abdominis. It runs parallel to the axis of the body, but where is it located? Abdominis, right, in the abdominal region. So this is the rectus abdominis. This is the big muscle responsible for your 6-pack, right, or your 8-pack, or maybe it's not a 6 or 8-pack, maybe it's a 2-pack. I don't know. And there's an oblique muscle right nearby. This is the external oblique. Look at the direction of the fibers, the muscle fibers run, kind of not horizontal, not vertical, but at an angle, right, to the body's axis. You've got 4 abdominal muscles here. The rectus abdominis. Think about what this muscle does when it contracts. If it attaches up here at the origin and its insertions down here on the pelvic bone, right? Excuse me, the origin is down here on the pelvic bone. The insertion is actually up here on the lower ribs and areas there. Think about what that does. It's a sit-up, right? So if you do a sit-up, do a couple sit-ups and feel that muscle doing its job. The oblique muscles help you kind of twist the external oblique. There's an external oblique here and then an internal oblique. And the direction the fibers run are just opposite of one another, from external, the more superficial muscle, to internal. The most internal abdominal muscle is called the transverse abdominis. Look at the direction of the fibers. They run in a transverse plane. So that transverse abdominis basically runs from one side of the abdomen all the way to the other, that's deep to all of them. And when you contract your abdominal muscles, it basically just compresses the abdomen. So those are the four abdominal muscles. Other muscles that originate on the trunk but insert on the upper limbs control gross movement of the limbs. So think about adduction and abduction and medial and lateral rotation of the upper arm and the thigh. They're often pretty powerful and large. So we'll talk about some of them on these next few slides, like the pectoralis major muscle, the pec muscle. This pec muscle, what can you do with this pectoralis muscle? Right, so bench press. If you've ever been in the gym, you bench press. You can bench press using this pectoralis muscle. So the origin's over here on the sternum, and the insertion's out here on the humerus. So the actions that you can do are basically flexion of the upper arm, the pectoralis major, adduction of the arm, bring it closer to the midline of the body, and medially rotate, right? So you can do a lot of actions with this muscle. It's a big muscle, it's a strong muscle. The others that I want to point out are, I think, a little bit better seen on the next few slides. So like the deltoid muscle, there's the posterior side of the deltoid. That big shoulder muscle I keep asking you to grab a hold of that can abduct, take your arm away from the body. And it also can flex and hyperextend the upper arm. That's the deltoid muscle. Here's the trapezius, one half of the trapezius. You don't see it on this side because it's cut away so you can see the deeper muscles. But the trapezius muscle, its origins all the way up here on the occipital bone, runs all the way down the vertebral column. It actually originates on the spinous processes of some cervical and thoracic vertebrae, but also has multiple points of origin. And it inserts out here on the shoulder in both the clavicle and the scapula, mostly the scapula. So look at what this muscle can do. It can move the scapula, it can shrug your shoulders, lots of different actions of this muscle. It's a big, big muscle. And then inferiorly is the latissimus dorsi. So if you've ever been to a gym, you know what a lat pull down is. The lat pull down is focusing on the latissimus dorsi, this big, huge muscle here. And that latissimus dorsi originates here on the thoracic and lumbar vertebrae, but inserts on the humerus. So if you raise your hands up over your head and pull like you're pulling down on a bar in the gym, the lat pull down, that's working your latissimus dorsi. And that's the muscles that originate on the trunk. but move the upper limbs. The gluteus maximus is this big muscle that originates here on the sacrum and ilium, the sacral bone and the ilium, so the hip bones, and actually inserts way down on the lateral part of the leg. And you can laterally rotate or externally rotate, but also abduct, take the leg away from the body, right? So this gluteus maximus is a pretty big muscle, and it's strong. The proximal muscles are much in the upper limbs. So we're going to move on to the appendicular skeleton. The proximal limb muscles are much stronger, but they're fewer and much less precise than distal muscles. So they're just big movements, strong movements. The distal muscles are really kind of involved in fine movements. The distal muscles in the lower arm, in the forearm, and in the lower leg. So let's talk about some of them. Like the triceps brachii. This is the posterior side of the upper arm. The triceps brachii is this muscle here. It has three origins. There's one part of the tricep. There's the second and the third. So the triceps brachii is the agonist muscle that extends the elbow. On the anterior side, you've got the biceps brachii, but another muscle that helps the bicep do its job. So the biceps brachii has two origins, and it inserts on the radius. The brachialis muscle is a muscle that originates on the humerus, but then inserts on the ulna. So between these two muscles, the biceps brachii and the brachialis, the biceps brachii inserts on the radius, brachialis on the ulna, and collectively they work together to flex the elbow. These muscles cross the elbow joint anteriorly, and if a muscle crosses a joint, it acts on that joint. The other muscle here that we discussed earlier was the brachioradialis, which also flexes the elbow. So all three, the brachialis and the brachioradialis, are synergist muscles to the biceps brachii. They help the biceps brachii do its job. In the upper leg, so we're moving on to the lower appendicular skeleton, but the thigh, there's two groups of muscles, the hamstrings and the quadriceps. But the flexors of the hamstrings flex the knee, the quadriceps extend the knee. So let's talk about the three hamstrings first. The three hamstrings are the semitendinosus, the semimembranosus, and the biceps femoris. So the biceps femoris is the only of the three that inserts laterally. So this is the lateral side of the leg. We're looking at the posterior and then lateral portion here that inserts on the fibula. So there's the insertion of the biceps femoris. Remember, the bicep muscle has two origins. But the biceps brachii is in the brachial region, and the biceps femoris is in the femoral region, the thigh, right? That's the femoral region. And this one inserts on the fibula. The other two are the semitendinosus, and the semitendinosus T sits on top of the semimembranosus, and also with a T, both of these muscles insert on the tibia. So the semitendinosus, semimembranosus insert on the tibia, and the semitendinosus sits on top of the semimembranosus. And all three of these muscles together work to flex the knee. So right there, you can see the knee joint. There's the femur, the condyles of the femur, and here's the tibia and fibula. So this is crossing the posterior side of the knee joint. So flex your knee and feel those hamstrings doing their job. Anteriorly, there's extensors of the knee, the quadriceps muscles, and there are four. I think quad is four, right? Let's talk about them. The quadriceps muscles are the rectus femoris. So remember, a rectus muscle runs along the parallel axis of the body. So this rectus muscle, like the rectus abdominis was in the abdominal region, the rectus femoris is in the femoral region. So this is the rectus femoris here. The vastus medialis runs medially down the anterior portion of the leg. The vastus lateralis runs laterally down the anterior portion of the leg, and the vastus intermedius is deep to the rectus femoris. So you can't see it in this figure, but all four of these quadriceps muscles converge onto a tendon. It's called the quadriceps tendon that runs past and over the patella, your kneecap, and becomes a ligament. Remember, tendons attach muscle to bone. Ligaments attach bone to bone. So this patellar ligament attaches this whole ligamentous structure, this whole connective tissue structure, to the tibial tuberosity in the tibia. And when these muscles contract, the quadriceps muscles, you extend your knee. So go ahead and extend your knee way out and feel those quadriceps doing their job. Two last muscles we're going to talk about are the gastrocnemius and the soleus. So the gastrocnemius and the soleus are ankle extensors. They are plantar flexors. And they're muscles that when you point your toes or go up on your tiptoes when you're standing, these two muscles do that same job because they both insert on the same bone. So take a look. This is the gastrocnemius, your big calf muscle. So go up on your toes or go up on your tiptoes or plantar flex your ankle and feel that big calf muscle in the back of your leg. Well, deep to that and just a little bit distal to that is the soleus. So keep doing that plantar flexion and then feel below where you feel the bumps of the gastrocnemius. Underneath that and below that is the soleus. And both of those muscles originate, actually the gastrocnemius originates on the femur. The soleus originates on the posterior side of the tibia. They both insert on one of the tarsal bones called the calcaneus. So right here's a calcaneal tendon, which is your Achilles tendon. And you can feel that when you plantar flex. And there's a lateral view of it. So here's the gastrocnemius and the soleus, and you can see where they both converge onto the same tendon and an insert on the calcaneus. All right, and that concludes chapter 6. All right. I will see you in chapter 7.